Okay, so we started earlier this week talking about Ephesians chapter 6, really verses 1 through 3. But today I want to look at a specific idea that has to do with abuse. Really, and it's for us to understand, how do we spot someone who's been struggling with some of those things? So what are some of the behavior indicators that perhaps someone has undergone abuse? What are some of those things that you point for us to be watching for?
Yeah, so there's a long list of potential signs and symptoms of abuse that a child or even the parent giving the abuse might show. But also in this list, just because one or two might be present doesn't mean there is abuse present. So just keep that in mind as you hear some of these. So a few would be sudden changes in behavior or performance at school, so something that's out of the ordinary. Being watchful as though something bad could happen. The child doesn't want to go home. They might have unexplained injuries. They shrink at the approach of adults. They have frequent absences from school. They aren't receiving the medical or dental care that they need. They are consistently dirty. They don't have good hygiene. They report having nightmares, or they have age-inappropriate bedwetting. There's unusual or inappropriate sexual knowledge or behavior. There might be extremes in behavior, like overly compliant or overly demanding, overly passive or overly aggressive, and then delays in development as well in the children. And then signs in the parent could be they might see their child as being entirely bad, worthless, or burdensome. They might use harsh discipline. They might have a history of abuse themselves as a child. They're at a higher risk of being abusive if they abuse substances like drugs or alcohol, or they act unconcerned about the child and refuse to accept help for maybe some problems that the child is facing.
So those are some areas where if you saw one or two of those, you're not necessarily jumping to conclusions, but if you're seeing all of them, you're certainly beginning to hone in and say, okay, let's be watchful and see if we can gather anything else. At what point would you say, okay, we need to hotline somebody, or we need to reach out for help, or we need to report this to someone? Where is that threshold?
Sure. I mean, there could be abuse present and you're only seeing one sign. It's not necessarily that you'll see all of them. But if you are seeing signs, I would just say be a little more cautious and just watch that child or that parent a little bit more closely, and just keep your eyes and ears open. And if you have some information and even some evidence that there has been abuse or neglect present in the home, absolutely hotline it or talk with either a teacher or a school counselor or a mental health counselor outside of the school. I would always recommend hotlining just to be cautious rather than kind of downplaying it and not taking those steps.
What are some of the common patterns of self-perception once someone has undergone abuse?
Yeah, so I think this is one that has the longer lasting effects on a child or even an adult that experiences some kind of abuse, or even you could describe it as a traumatic event. So when you're a child and you're growing up, your job is to learn and to take in everything around you. And if you're receiving abuse or really harsh discipline or neglect from a parent, you're learning from that experience. And your parent or primary caregiver is supposed to be the one person that loves you unconditionally. And if you're not receiving that as a child, you're then explaining that in your mind. And it's usually explained as something internal, as I'm no good, or I'm not worth their time, or I must be bad, or I don't have any value. And that really sticks with the child long past childhood. In my time working with adolescents, that was the big piece that then expanded across multiple different areas of their life, not only just that relationship with their parent, but socially in school, with their peers, how they viewed themselves with their own moods, and the mental health diagnoses that they had. So that self-perception is huge, and I think has the biggest impact on the child when they are receiving abuse. And even it can be interpreted that way without that extreme of abuse. And I think that kind of brings us back to that idea of, what am I communicating to my child? You may not be hitting your child or beating your child and causing physical abuse, but there could be interactions that then communicate to the child that they don't have any worth or value, and that sticks with them. And if they don't put in the work to try and reverse some of those things through self-reflection and therapy, then that has the potential to stick with them forever.
What are some of the patterns that you would see in somebody who has been physically abused? What are some of the bad decisions that they're prone to then act out in their life?
So they might be more likely to abuse their own children in the future, or even their partner when they're in a romantic relationship in the future. It can even have an impact on their successes in life too. When children and even adults go through these traumatic experiences of that abuse, but even the emotional part of it, of being told and communicated that you're no good and that you have no value, that creates stress in the body. And we know that when you have a lot of stress in the body, that not only impacts your mental health, but your physical health too.
As somebody who has sat with many people in my own office trying to work through, I think that there are some indicators of what happens sexually to a child who's abused and how then they act out. What are the things that you would say that you've seen as far as patterns for somebody who's been sexually abused?
Yeah, so especially in a child, at a younger age, when maybe you haven't had conversations about sex with them, or you know that they likely haven't had those conversations in school yet either. If they're showing a knowledge of sex at an age that you feel is pretty inappropriate, or that you have a good idea that they haven't been taught that in an appropriate setting, I would say that's concerning. But also inappropriate sexual behaviors as well at those younger ages. As children are getting older and into teenage years, there's that exploration piece that some teenagers choose to do. But when it falls on that outlying, the bizarre and extreme cases, that's definitely an instance. And even into adulthood, it can impact their romantic relationships too. Like that can be an issue in their marriage in the future. If they've experienced sexual abuse, that can almost guarantee sexual problems in their marriage later on. So
certainly things worth working through in a healthy way and coming to a place where you can explain how that was wounding, right? One of the things that I've seen is people who have been abused either act out in a hypersexual way or refrain from it completely. That it takes away the innocence, the curiosity, and they become either hyperactive sexually, or they withdraw from that. And so I then look back at young people in school that I went to school with and think, my heart breaks for what they had experienced at such a young age. And you don't even realize why and what's going on. Is that something that is scientifically backed, or is that just something that?
I think it would be hard to say, because sexual abuse is something that is more often unreported. So I think the research behind that would be difficult, because we don't have a way of knowing for sure if every single person that has been sexually abused, if they act out in either extreme. Because they're, unfortunately, especially when I was serving as an individual therapist, I worked with trauma the most. I think that was one piece of trauma that came out the most of, I've never told anybody this before, but here's something that happened to me, because it's often unreported.
That's certainly something we need to be thinking about and praying through. Something that a church should be alert to, but oftentimes we're silent on. And so thank you for helping us with that, and help us continue to journey through this, that we can be the hand of Christ on some of these things.